If you're over 60, there's a quiet danger sitting right in your bathroom cabinet. Millions of seniors take pills every day that they assume are helping them. But what if some of those pills are slowly draining your energy, weakening your bones, or even harming your brain? Many people don't realize the long-term risks of medications until it's too late. I regret not asking the right questions sooner. And if this video spares even one person from going through what I did, it's worth it. If you're taking any regular medications or care for someone who does, please subscribe to this channel and share your experience in the comments. We're building a community that speaks honestly about senior health, without fear and without judgment. Your story might help someone else live longer and stronger. Every year, millions of older adults are prescribed medications to control acid reflux or heartburn. These drugs, known as proton pump inhibitors or PPIs, seem helpful at first. They promise quick relief from that burning sensation in the chest. But what many seniors aren't told is what happens when these pills are used day after day, month after month, year after year. Doctors have observed that long-term use of PPIs in people over 65 can quietly cause serious harm. It doesn't happen overnight. It starts slowly, without warning signs. You feel fine, you keep taking the pill every morning. But inside, something else is happening. One of the biggest dangers is vitamin B12 deficiency. PPIs reduce stomach acid. Too much acid can be painful, but we actually need some acid to absorb key nutrients. Vitamin B12 is one of them. Without enough stomach acid, your body can't break down and absorb B12 from food. Over time, a silent deficiency begins. Seniors often don't notice until they feel weak, tired, forgetful, or dizzy. These aren't just normal signs of aging. In some cases, low B12 can even lead to irreversible nerve damage. But it doesn't stop there. Studies show a strong link between long-term PPI use and a higher risk of kidney problems in older adults. The kidneys, which work quietly to filter the blood, can become inflamed without obvious symptoms. This condition, called interstitial nephritis, has been found in people taking PPIs regularly. Left untreated, it can lead to chronic kidney disease. Seniors may not realize anything is wrong until their blood tests raise red flags, or worse, they begin to feel sick. Even more concerning is what research is now uncovering about the brain. Experts explain that extended PPI use may be linked to an increased risk of dementia. While the exact connection is still being studied, researchers have noted changes in cognitive function, especially in older patients who've been taking these medications for years. Memory slips, slower thinking, foggy days. These are not just part of growing older. In some cases, they may be traced back to a small pill taken faithfully every day, without question. Doctors have also observed that PPIs can lead to weaker bones. The same stomach acid that helps absorb B12 also plays a role in absorbing calcium. Without enough calcium, bones become brittle. Fragile bones mean greater risk of fractures, especially in the hip and spine. A simple fall could turn into a life-changing injury. This is not something to overlook, especially for people in their 70s and beyond. Another concern is infection. When stomach acid is reduced, it becomes easier for harmful bacteria to survive and travel through the digestive system. This can increase the risk of gut infections, like Clostridium difficile, a dangerous condition that can cause severe diarrhea, dehydration, and even hospitalization. Older adults are particularly vulnerable, and recovery can be long and difficult. Many people don't even realize they're taking a PPI. Names like omeprazole, lansoprazole, esomeprazole. These may sound familiar. Sometimes they're prescribed after surgery or after a rough patch of stomach pain. But the prescription never ends. Refills keep coming. The discomfort goes away, so the pill becomes part of the daily routine. It feels harmless, but studies show that in many cases, long-term PPI use isn't necessary. Doctors now agree that for many seniors, lifestyle changes, shorter courses of medication, or safer alternatives can be just as effective without the hidden risks. The problem is those conversations don't always happen. People trust their prescriptions, They assume if it was harmful, someone would have said something. That assumption sadly can lead to long-term harm. This is not a message of fear. It's a reminder to pause and ask questions. If you or someone you love is taking a PPI, especially after age 60, it's worth speaking to a doctor or pharmacist about how long it's truly needed. Not out of panic, but out of wisdom. Your body deserves careful attention, and you deserve to know what each pill is really doing. There is power in awareness. What seems small today could shape your health tomorrow. You are not helpless. You are not stuck. Even if you've taken a medication for years, it's never too late to ask, learn, and take back control of your health. One thoughtful step today may protect your brain, your bones, your kidneys, and your energy for years to come. Trouble sleeping is something many older adults face. It can feel frustrating, even lonely, to lie awake at night while the rest of the world rests. For this reason, sleeping pills like zolpidem or benzodiazepines are often prescribed. They promise relief. A few minutes after swallowing the tablet, the body relaxes, and sleep finally comes. But doctors have observed that what seems like a peaceful solution can turn into a dangerous habit, especially for those over 65. Experts explain that the aging brain responds differently to medications. What may be safe for a younger person can create far more serious risks for a senior. With sleeping pills, the dangers often stay hidden until something goes wrong. Over time, the body builds a tolerance, meaning the same pill becomes less effective. Seniors may start taking higher doses without realizing the risk. But the real danger isn't just the dose. It's the way these drugs affect the brain, balance, and memory over time. Doctors have observed that regular use of sleeping pills in older adults is strongly linked to falls. These are not just stumbles. A fall at this age can mean broken hips, fractured wrists, or even traumatic head injuries. Once hospitalized, many seniors never fully regain their independence. What caused the fall? Often, it's dizziness or slowed. Reflexes, side effects of pills taken the night before. These pills don't always wear off by morning. Their effects can linger, making even a short walk to the bathroom a potential hazard. Memory problems are another hidden cost. Experts warn that benzodiazepines and similar sedatives can interfere with short-term memory and clear thinking. Seniors may notice they're forgetting more names, misplacing items, or losing track of conversations. What's worse is that these signs can be mistaken for dementia. In some cases, when the medication is removed, the confusion lifts. But for others, the damage may be longer lasting. A drug that was meant to bring rest ends up clouding the mind. Doctors also point to long-term dependence as a growing concern. Many seniors begin taking these medications for a short time, just a week or two. But months go by, and they're still using them nightly. The body becomes reliant, making it harder to sleep without them. This creates a cycle where the brain no longer remembers how to fall asleep naturally. When a person tries to stop, withdrawal symptoms can appear: anxiety, restlessness, or even worse, insomnia. It becomes harder to break free. What most people aren't told is that better options exist. Studies show that certain behavioral therapies, like sleep scheduling, calming bedtime routines, and light exposure in the morning, can work just as well without the risks. Doctors now recommend these methods for seniors as the safest first choice. Yet, many are only offered pills. There's also the emotional toll. Relying on a medication every night can lead to fear. What if the pill runs out? What if it stops working? That anxiety can build, making sleep feel even harder to reach. Seniors deserve better than that. They deserve a solution that brings rest without fear, clarity without confusion, and safety without risk. Experts explain that sleep naturally changes with age. It becomes lighter. Waking up once or twice during the night is common and not always a problem. But the pressure to sleep perfectly, like in younger years, can lead people to seek quick fixes. The truth is, the body and brain can adapt. With gentle support and the right guidance, natural sleep can return. It's not about blame. Many people were simply doing what they were told. They trusted their doctor, trusted the prescription, And sometimes, in the moment, it helped. But now we know more. And knowing more means we can choose differently. If you or someone you love is taking a sleeping pill regularly, don't be afraid. You are not alone and you are not stuck. Speak with a healthcare professional about your options. Ask what else is available. Ask what steps can help your body rest naturally again. It may take time, but it's possible. And it's worth it, because a clear mind, strong balance, and peaceful sleep aren't just nice to have. They're essential to living fully and safely at any age. You deserve that. You deserve rest that heals, not harms. And today is a good day to take that first step. Many older adults take a pill at night to help them fall asleep, one that's easy to find, no prescription needed. It's sold over the counter and often labeled as a nighttime allergy medicine. The name on the box might be Diphenhydramine. You may know it as Benadryl or another familiar brand. But doctors have warned that for seniors, this everyday medicine can cause serious problems, especially when used night after night. Experts explain that diphenhydramine belongs to a group of drugs with anticholinergic effects. That means it blocks a natural chemical in the brain called acetylcholine, which helps with memory, alertness, and coordination. As we age, our brain becomes more sensitive to anything that interferes with this chemical. What feels like simple drowsiness can actually be something deeper, something that slowly affects how you think, move, and feel. Doctors have observed that when seniors take antihistamines like diphenhydramine regularly, they are more likely to experience confusion, grogginess, and slower thinking. You may wake up feeling like you haven't rested at all. You might notice that conversations are harder to follow, that your thoughts feel clouded. Some studies show that long-term use of strong anticholinergic drugs in people over 65 may even raise the risk of dementia. It doesn't happen suddenly. It happens quietly, over time, while the medication continues to be used without question. Many seniors start using these pills not because of allergies, but because they can't sleep. The packaging often says nighttime relief or PM formula. The effect is drowsiness. That makes it feel like a harmless sleep aid. But sleep that's forced by brain-slowing chemicals is not the same as natural, healthy rest. And over time, the body can become dependent. People start taking more, or they rely on the pill to sleep every night. That habit becomes hard to break. Doctors also point to physical risks. These drugs can cause dizziness or blurred vision. Seniors may not feel steady on their feet, especially at night. Walking to the bathroom in the dark becomes dangerous. One missed step, and a fall can lead to a broken bone or a hospital stay. These falls aren't just painful, they can change the course of your life. A fracture in your 70s or 80s can take months to heal, and full recovery is never guaranteed. Even during the day, the effects can linger. Some older adults report feeling spaced out, off balance, or unsteady hours after taking the pill. They might sit more, avoid walking, or stay isolated, thinking it's just aging. But in many cases, it's the medication that's stealing their energy and clarity. Doctors have observed that when the drug is stopped, these symptoms often improve. Another concern is how these drugs interact with other medications. Seniors often take pills for blood pressure, heart conditions, or diabetes. Diphenhydramine and similar drugs can interfere with those treatments or make side effects worse. Yet because it's available without a prescription, many people assume it's completely safe. They don't realize the danger of mixing it with their other daily medicines. Studies show that even one anticholinergic medication, taken regularly, can affect brain health over time. When seniors take more than one, the risks increase. Many common drugs, including those for bladder issues or depression, already have anticholinergic effects. Adding an over-the-counter antihistamine on top creates a stronger impact. Most people are never warned. They trust what's on the pharmacy shelf. Doctors now urge older adults to avoid these medications for sleep or long-term use. Safer options exist. Gentle sleep routines, daytime light exposure, and small changes in daily habits can make a big difference. There are also sleep aids designed specifically for seniors that don't carry the same brain or balance risks. The key is to ask questions and be informed before a harmless-looking pill causes real harm. If you or someone you love uses a nighttime antihistamine regularly, it's not too late. Don't be afraid to bring it up with a doctor or pharmacist. Ask if it's truly safe. Ask if there's a better option. You deserve to feel clear-headed, steady, and well-rested without risking your memory or mobility. Your health matters. Your mind matters. And your sleep should support your life, not take away from it. Today is a good day to look again at what's in your medicine cabinet. One small change can protect your body, your brain, and your future. Statins are some of the most commonly prescribed medications in the world. They're used to lower cholesterol and reduce the risk of heart disease. For many people, they have played a powerful role in preventing heart attacks and strokes. But doctors have observed that for some older adults, especially those over 70 who are otherwise healthy, the picture isn't so clear. What's meant to protect the heart may sometimes harm the body in other unexpected ways. Experts explain that statins work by blocking a substance the body needs to make cholesterol. That sounds helpful, and in many cases it is. But cholesterol is also important for the brain, muscles, and hormone production. As the body ages, it becomes more sensitive to how medications work. Seniors often process drugs more slowly. This means the effects of statins, both good and bad, can show up differently in older adults than in younger people. Doctors have observed that some seniors taking statins begin to notice muscle pain or weakness. It may start with a dull ache, the legs, or a sense that walking feels harder than it used to. Others describe feeling tired more easily, even after simple activities. These signs are often dismissed as part of aging, but studies show a link between statin use and muscle-related side effects in older patients. In some cases, the discomfort is enough to interfere with daily life. Getting up from a chair, walking upstairs, or going for a short stroll might feel unusually difficult. Fatigue is another concern. Seniors who were once active and alert may feel drained, even without a clear reason. Doctors explain that while statins can lower cholesterol, they can also lower levels of something called CoQ10, a natural enzyme the body uses to produce energy. When levels drop too low, the result can be a persistent sense of tiredness that no nap seems to fix. There are also growing questions about how statins affect memory. Some studies have suggested a possible connection between statin use and memory loss or confusion in seniors. The research is still being explored, and results have been mixed. But the concern is real enough that the U.S. Food and Drug Administration issued a warning about potential cognitive side effects. Doctors have observed patients reporting foggy thinking, forgetfulness, or trouble focusing after starting the medication. For some, these symptoms improve after stopping or adjusting the dose. Experts explain that the key issue isn't whether statins are good or bad, it's whether they're necessary for every senior. In adults over 70 who have never had heart disease or a stroke, the benefits of taking a statin might not outweigh the risks. Yet many continue the prescription simply because it was started years ago. They assume it's still needed, without reevaluating whether their health has changed or whether the original reason still applies. Doctors now encourage older adults to ask important questions. Why am I still taking this? Do I still need it at my age and current health level? Could there be a safer way to manage my heart risk? In many cases, lifestyle changes, like better food choices, light daily movement, and stress reduction, can support heart health without the side effects of medication. But these options are rarely offered as replacements, especially when a pill seems like an easy fix. For some seniors, especially those with a history of heart problems, statins can be life-saving. The goal is not to create fear, but to create awareness. Each person's body, risks, and needs are different. What works well for one person may not be the right fit for another. That's why experts now emphasize the importance of personalized care, especially as people enter their 70s and beyond. If you're over 70 and still taking a statin, don't make any sudden decisions, but do start the conversation. Bring it up during your next checkup. Ask whether your current dose is necessary. Ask if there are signs your body isn't tolerating it well. You have a right to understand what each pill is doing, and whether it's still doing what it was meant to do. The goal isn't just to live longer, it's to live better. Stronger muscles, a clearer mind, more energy for the things you love. You deserve that. And if asking one question today can protect that tomorrow, it's a question worth asking. Pain is a part of life that many seniors know all too well. Aching joints, sore backs, or stiff hands often lead to one common solution: grabbing an over-the-counter pain reliever. Medications like ibuprofen and naproxen are easy to find and promise fast relief. But doctors have observed that for older adults, using these drugs regularly over time can quietly create more harm than healing. Experts explain that these medications belong to a group called non-steroidal anti-inflammatory drugs, or NSAIDs. While they help reduce pain and swelling, they also affect how the stomach, kidneys, and blood vessels work, especially in people over 65. The risks are often invisible at first, which is why so many seniors continue taking them without realizing the damage being done. One of the most serious concerns is the stomach. NSAIDs can weaken the protective lining inside the stomach wall. Over time, this can lead to irritation, ulcers, or even bleeding. Doctors have seen cases where seniors arrive at the hospital with internal bleeding and no idea that their daily pain pill was the cause. The pain in their joints may have eased, but the pain inside went unnoticed until it became an emergency. Researchers have also found that NSAIDs can affect the kidneys. These organs act like filters, quietly working all day to clean the blood. But NSAIDs can interfere with blood flow to the kidneys, especially in older adults. That means the kidneys have to work harder to do their job. Over months or years, this strain can cause lasting damage. Some seniors don't notice until blood tests show reduced kidney function, or until swelling, fatigue, or other symptoms appear. The connection to their pain reliever often goes unrecognized. Blood pressure is another hidden risk. Doctors have observed that regular use of NSAIDs can raise blood pressure levels, even in people who had it under control before. For seniors already managing hypertension, this creates a dangerous situation. Higher blood pressure increases the risk of heart problems, strokes, and other serious complications. The pill meant to relieve one kind of pain can end up creating an even more dangerous one in return. One reason these risks go unnoticed is that NSAIDs don't require a prescription. They're in every drugstore, often on the same shelf as vitamins. This gives the impression that they're completely safe. But experts explain that the risks of these medications are very real, especially when taken daily or for more than a few weeks at a time. The body of a 70-year-old handles medication very differently from that of a 40-year-old. The difference matters. Another problem is that pain doesn't always go away quickly. Arthritis, back pain, and joint stiffness can last for years. Seniors may start with 1 or 2 pills a day, and over time, it becomes a routine. The body adjusts. The pain relief seems mild, so they take more or take it longer, hoping for relief. What they don't see are the slow changes happening inside, until a new health problem appears, and no one realizes the link. Doctors now urge seniors to avoid long-term NSAID use whenever possible. For occasional pain, they may be useful, but for chronic conditions, other options should be explored. Experts explain that there are safer pain management strategies for older adults, such as physical therapy, gentle stretching, topical creams, or targeted treatments that don't carry the same internal risks. For those who truly need pain relief every day, it's important to speak with a doctor. Not just about what helps the pain, but about what the body can safely handle. There are times when short-term use of NSAIDs makes sense, but the key is to use them with awareness, not as a silent habit. If you or someone you love is using ibuprofen, naproxen, or another NSAID regularly, ask how long it's been. Ask what it may be doing to your stomach, your kidneys, or your heart. You have a right to know what's really going on. You have a right to feel better, without trading one kind of pain for another. Living pain-free is a goal worth pursuing, but it should never come at the cost of your long-term health. You deserve strength, comfort, and peace of mind. And you deserve solutions that heal, not harm. Start today with a simple question. It might be the beginning of real, lasting relief.